Welcome to HN Diet and Health Portal. Coronavirus drug. What is dexamethasone and how does it work? All you need to know. An anti-inflammatory drug called dexamethasone has been hailed as a groundbreaking treatment for hospitalized patients seriously ill with COVID-19. A UK trial showed the drug could save lives, the first internationally to do so, and it can be used in the NHS immediately. What is the drug? Dexamethasone is a steroid, a medicine that reduces inflammation by mimicking anti-inflammatory hormones produced by the body. How does it work? This drug works by dampening down the body's immune system. Coronavirus infection triggers inflammation as the body tries to fight it off. But sometimes the immune system goes into overdrive, and it's this reaction that can prove fatal. The very reaction designed to attack infection ends up attacking the body's own cells. How effective is it? According to the scientists who carried out the trials, 1 in 3 deaths could be prevented among patients on ventilators. For patients on oxygen, it could prevent 1 death in 5. There was no significant benefit for patients who were not receiving respiratory support. What was the trial? The results come from the Recovery Randomized Evaluation of COVID-19 Therapy trial, conducted by the University of Oxford. It's testing whether existing medicines used for other conditions could also be useful in treating COVID-19. About 2,100 patients received a 6 mg daily dose of dexamethasone in the trial for 10 days. Scientists hope dexamethasone could eventually be used as part of a suite of drugs which together could reduce deaths even further. It is now recommended for adults, not including those who are pregnant or breastfeeding. What have the dexamethasone trial results shown? The results have shown that giving low doses of dexamethasone to patients reduced death rates by around 1/3 among those with the most severe cases of infection. The data further showed for patients on ventilators, it cut the risk of death from 40% to 28%. For patients needing oxygen, it cut the risk of death from 25% to 20%. Researchers estimate that the drug will prevent 1 death for every 8 patients treated while on breathing machines and 1 for every 25 patients on extra oxygen alone, AP reported. This is a result that shows that if patients who have COVID-19 and are on ventilators or are on oxygen are given dexamethasone, it will save lives, and it will do so at a remarkably low cost. Martin Landray, an Oxford University professor. However, dexamethasone does not appear to help people with milder symptoms of coronavirus, those who don't need help with their breathing. How widely available is the drug? Dexamethasone is a low-cost drug that already exists and is in good supply. The UK government says it has already stockpiled enough of the drug to treat 200,000 people, in anticipation of a good result from the trial. In the UK, the drug will cost £5.40 a day per patient, and the treatment lasts for up to 10 days. The Department of Health and Social Care says the drug has also been added to the government's parallel export list. It was first made in 1957 and became available for use in the UK in the early 1960s. Because it's been around for such a long time, the drug is out of patent. That means lots of different companies can make it, and it is widely available around the world. The Department of Health and Social Care says the drug has also been added to the government's parallel export list. which bans companies from buying medicines meant for UK patients and selling them on for a higher price in another country. What is the price of dexamethasone? In the US, the average retail price is under $50, while in the UK, it costs about £5. There is a clear benefit. The treatment is up to 10 days of dexamethasone and it costs about £5 per patient. So essentially it costs £35 to save a life. This is a drug that is globally available. Martin Landray. What's reaction been worldwide? The World Health Organization has welcomed the trial results, saying more therapies are now needed for milder symptoms. In many African nations, for example, the drug costs less than $2. In South Africa, where the drug is manufactured, the government has already been advised to use it to treat patients on oxygen or ventilation support. Data from the WHO shows that more than 5,000 people have died from COVID-19 in Africa, the majority of whom had underlying health conditions. What other conditions is it used for? The drug can help treat various illnesses involving inflammation or swelling in the body, conditions where the immune system goes into overdrive. For example, severe asthma, which can cause inflammation in the airways and lungs, severe allergic reactions or painful, inflamed joints. Dexamethasone is also useful in autoimmune conditions such as rheumatoid arthritis or lupus, which are caused by the immune system mistakenly attacking the body. Are there any side effects? Common side effects of dexamethasone used for other conditions include anxiety, difficulty sleeping, weight gain and fluid retention. Rarer side effects include eye disorders, blurred vision and hemorrhage. However, coronavirus patients only need a relatively low dose which should limit side effects. The Chief Medical Officer for England said there were no excess harms identified in using this dose of dexamethasone in this patient population. Let comment us below. Thank you for watching. Share with others.